Can you hear me? Okay, well, our coalition started in the year 2000, and our piece of this is we are the prevention program in this community, and we're a coalition that includes the school district, the police department, community-based organizations, students, teachers, clergy, so that we work together as a group to look at prevention in this community. And we look at it in terms of the culture. And we said when we started that our aim is to change the culture. We're probably on a 20 to 30-year mission, if that. And so we're only in year 10. So we've got a ways to go. But one of the things we look at is that in Long Beach, we know that alcohol and liquor drugs are available, accessible, and sometimes acceptable. And that's what we really want to change. There's a quote that I often see in my field, and it's that holding young people solely responsible for underage drinking is like holding a fish responsible for dying in a polluted stream. It's up to us as a community to start to change the way we look at things, because really, the gateway drug, no one that we know, or rarely anyone, starts with heroin. It starts with mostly alcohol is the #1 drug of choice of our kids who are under 21. And then they go to prescription drugs at farm parties. And those drugs are in and of itself addictive. And as Michael told you, what happens is the iStout program and other things that have gone on have managed to make those prescription drugs cost between $15 and $20 a pill. So it's a very, very hard habit to sustain. And heroin is cheap and easy. So one of our messages is, though, that we want you to walk away from here with things you absolutely can do. Okay, concrete things that you can do. First of all, there is a tool. It's called ESPER, and it's Screening and Brief Intervention. And it's supported by SAMHSA, and there's a tool for youth and there's a tool for adults. And it's like 5 questions that your local physician can ask young people or their regular patients. And the truth of the matter is that the research shows that simply by asking those 5 questions, the experts at CDC called it inoculation. There's been those who do it, there's a 67% decrease in illicit drugs and a 50% decrease in drinking. Simply by having a conversation, not necessarily by those people that are moving on into treatment, but somebody's aware. And so that's one very powerful tool. What can we do? I'm a kind of think globally and act locally person. So while instituting that statewide and countywide might take some time, we can ask our own physicians. I know some of my staff visited some of the pediatricians in town and got a positive response. We can ask them to start doing ESPERT now. It is absolutely an easy thing to do, and guess what? It's billable, and you can get reimbursed for it. So that's one thing we can do. We can also lock up our alcohol, because whether we have teenagers ourselves or we have young kids and we have babysitters coming into our room, it needs to be monitored. That's the gateway drug. That's the biggest gateway drug you've got going. We can also lock up our prescriptions, and we can participate in the prescription take-back programs, which I know we have once a year here. It's very, very important to do that. It's also important to have the open dialogue with our kids, but also with anybody else you know. If you know that someone is using or abusing prescription drugs, have that conversation. If you can't have that conversation with them, then have it with someone they know. Because if you're not part of the solution, unfortunately, you're going to be part of the problem. So that's basically, as a coalition, what we do. We try to do prevention, but it's environmental prevention. It's looking at the fact that we did a really great thing by having a 4-hour first night this New Year's Eve, and a not so great thing by proceeding it the week before with a bar crawl, a Santa bar crawl, because it encourages over-drinking, and that is a culture in this community that also encourages other substance use. So we want to change that. We want our kids to be safe here, and our adults to be safe. Thank you.
Before we move on, I just want to let you know about Taking Back Drug program that the county is working on with all the local police departments and the local pharmacies. The pharmacies will be able to take back the drugs into a locked container that the police will then pick up and destroy. CVS has signed on board. We're waiting on Rite Aid and some of the other major chains so that we can make sure that these drugs don't end up in our sewer system where they're improperly disposed of and a danger to our environment, and they don't end up in the hands of kids. One of the big expressions is, if you take prescription medication, who else in your house is taking your medicine? The next person to speak is Rick, so.
Thank you. Can everyone hear me? Okay. Very good. So I'm going to take a little bit of a different approach. As Mike had mentioned, my organization is SAIL. We're an organization based on the South Shore, and we've been kind of on the forefront of a lot of the Hurricane Sandy recovery efforts here in Long Beach specifically. I say that because a lot of times a very real thing in life is that when people experience trauma and they experience certain hardships in life, they resort to certain things like substance use or have a lot of stress, anxiety, depression, things that lead or resort to using certain substances, which, as statistics have shown, have risen over the last few years. I don't have statistics for you per se, but in the course of the last 15 months since Hurricane Sandy hit, we have seen a rise of people actually using certain substances, specifically alcohol. People in the South Shore have had a really hard time recovering from a lot of the disasters that had happened over it's from Hurricane Sandy, and so as a self-medication, they've been resorting to certain substances and things like that. So our organization, what we are going to start to unfold in the next 2 weeks is a recovery case management and clinical services program, which is a group of case managers and a group of clinicians, one specializing in substance abuse and one specializing strictly in mental health. And what we plan to do is actually provide support into the community, so not necessarily a clinic per se, but our counselors are going to go into your home or anywhere into the community where you feel more comfortable, where we can actually address certain issues that may have been exacerbated by Superstorm Sandy. I bring Sandy into the picture because, again, as I mentioned earlier, sometimes life events, it's a very real thing. We resort to a lot of these things, like substance abuse and whatever it might be. So those struggles that we face in life are a result of something that we've faced. So our program really is catered to the community. So whatever it is that the community members need, we'll mold our services for your support. So again, we have case management services, mental health services, supportive counseling, and substance abuse counseling. So following this panel, I'd be more than happy to talk to anybody about that. And if you know anybody who might be struggling in the area who would benefit from any of our services, we'd be more than happy to reach out to those individuals. So.